Hello, Namaste, Adab. I'm sure many of us have gone for physiotherapy treatment, है ना? कभी मेरा तो 2018 में I had a severe fall and then I understood the impact of physiotherapy. उसके पहले कभी समझ में नहीं आता था. I used to think, what is physiotherapy? Only after that I realized how important physiotherapy is for us. So today we are privileged to meet Dr. Laxmikanth Sabgani. Laxmikanth ji, namaste. How are you?
Yeah, I'm fine. I'm doing good. What about you?
Good, very nice. So let me introduce or let you, let the viewers hear from you about yourself.
More than 20 to 23 years of experience in the field of physiotherapy. I have done my masters in neuro, adult neuro, and super specialization in pediatric neuro.
So do you have a clinic in Hyderabad?
Yeah, I have two clinics. One at Attapur, one at Himayat.
So could you share your number or address with the viewers?
Yeah, my number is 9966 404 116. For any queries or anything, you can always contact me. I'm always on WhatsApp also. Any doubts, you can always contact me.
So, sir, you love your work. I can see it from your eyes that you just love your work. What made you become a physiotherapist?
Oh, actually, I have not chosen it. I think the field has chosen me. I really think so. Because I believe in destiny. The destiny plays a vital role in everything. So once I got to know about it, my brother told me it's a very good thing, upcoming field. You know, in 90s, there was no much physio colleges. So we had to go to Bangalore, Hyderabad. तो वहाँ पे देखे तो बहुत अच्छा था. And I didn't know that it's so vast, it's so in depth. So once I entered into it, it's very tough. If you study well, then only you get and acquiring knowledge, acquiring skills. See, physiotherapy is a skill-based thing. So once your skills are updated and correct, then only you'll be able to survive. You can be able to do justice to the patients, and in that way, we can do very good.
So do we have to prepare ourselves from the school level? Do we have to take subjects?
After intermediate, it should be 5 pieces. Okay. Then afterwards, you can go for the 4.5 year course. Okay. That's basic bachelor's. Then afterwards, you can have 2 years master course. You can choose your field in masters. Like example, neuro, ortho, then CT, cardiothoracic, gynec, hand rehabilitation, geriatric rehabilitation, pediatric rehabilitation. There are so many, different streams we can choose. And afterwards, if you want to do specialization, super specialization, you can do PhDs also. You can work as a research work. I also have done research in National Institute for the Mentally Handicapped. I worked in NIMH. I've done my PG diploma in early intervention, 0 to 3 years children. There, what I did is I have been observed there. So 3 years I worked there as a research officer, and I've written 3 books on it. Yeah.
3 books on neuro or
yeah, pediatric neuro, home program for the disabled. So that's a mentally retarded children. For mentally retarded children, how to in the home, how to deal with the child, and how to do exercise protocol and everything. One book. One other book which has been there for drooling बोले तो जो से लार निकलता है, लार टपकते रहता है, तो उसको वो ऐसे चिल्ड्रन बहुत ही डिफिकल्ट रहता है because they cannot control their mouth, they cannot close their mouth.
But why does this happen?
Because of neurological damage. So all neurological damage. बचपन में पैदा होते समय during the childbirth, before, during the childbirth or afterwards. ये 3 चीज रहते हैं. So before, if mother has any infections or any trauma psychological or any other things, then the child will also get affected. Then the secondary is during the childbirth, if the child doesn't cry, and if there is any trauma of while coming out, or any other things, if needness is not maintained, any infections, then also it can cause some of the other damages. Then if the child is not crying, or it's called failure to thrive, और उसमें भी you'll get some of the other problems. So उस वजह से brain में damage होने के chances बहुत ज़्यादा रहते हैं. तो एक बार brain damage हुआ, then intellectual disability, okay, then physical disabilities. So like that, so many others are there. Then there are also, what should I say, all genetic problems are also there in children. Genes में भी problem होने की वजह से so many other things will be there.
So how does physiotherapy help in these problems?
Yes. See, normally we say rehabilitation. Re बोले तो again. Habilitation बोले तो पहले जैसे थे वैसा उनको वैसा बनाना. But in children it is habilitation. Habilitation means first time उन्हें चलने की कोशिश कर रहे हैं. First time रहने की कोशिश कर रहे हैं. First time खड़े रहने की कोशिश कर रहे हैं. So if somebody correctly, for example, if I want to lift this, this thing, so I'm holding it like this and taking it. For a disabled child, it will be very difficult. They might come like this and do it. It's not an efficient way of doing it. So what we do is the best and efficient way. We try to make them do all the activities. So that is physical therapy.
And do you have instruments for that, or just physical?
Hands-on techniques are wonderful things. Instruments will be there, but our field is a skill-based, hands-on techniques, and I am specialized in hands-on techniques. So, उसमें हाथों से जितना भी हो, we try to do all the activity-based and everything. उनका disability के ऊपर we try to do it. And in my clinic, I treat adult patients. Any pains or any neurological adult patients, सब लोगों को हम देखते हैं. We give best of the best treatments for it.
And how do yoga or the gym, all these, do they help in physical therapy or?
See, yoga is a science altogether. It's a different science altogether. If you do exercise, simple exercise, it's called physiotherapy. If you do add breathing exercise, with breathing if you do, it's called yoga. And yoga deals with mind and body. So that is also very good. So there is some simple variations are there, which you can do. And you asked for one more thing, what is it?
Gym.
Yoga and gym. Gym means again similar exercises only. Exercises is almost the same.
So all exercise based.
Yeah. What in physiotherapy we manage pain and we teach protocols. Like example, exercise protocols. They need to do to strengthening, so that once we get strengthening, the pain will automatically come down. Once the pain comes down, then you'll be restored to normalcy. So that's what we do.
Tell me, doctor, does normalcy really happen? Because many times people say, oh, एक बार physiotherapy शुरू होने से whole life physiotherapy होगा.
नहीं, ऐसा कुछ भी नहीं है. You go to the right place, right person, right time. Definitely, it is very important. If you don't go, see, you delay the process. आप जितना भी delay करते जाओगे, then it becomes more and more. Then you go. See, ours is external based treatments. तो हाथों से और external based. We don't go inside and do cut open. That's a thing of surgeons. That's not our best. So our limitation is we do it in our own things. So best of the best, ऊपर से ही करना है. So उसमें physical therapy will be the first and the best thing for anything. Instead of popping up any painkillers or any pains, this is the best thing. We can reduce the pain with exercises and other things.
And no painkillers.
Yeah. We should avoid painkillers as much as possible. Any chemical is a chemical.
Yeah.
So you can always avoid it.
So share your experiences with us, please.
Oh, there are a lot of experiences. So many experiences are there. People who have been told surgeries, who have been told it cannot be done anything, you have to go for surgeries. With God's grace, we have able to do it with best of the best our abilities without surgeries. Pains, problems has been solved with all God's grace. So many things are there. Back pains, neck pains, arthritis, so many things.
And nowadays we have a sedentary way of living.
Yeah.
So how is sedentary life, sedentary activities, how are they related to, I mean, do people with a sedentary lifestyle end up having osteoarthritis and pains
Anything possibility is there. Sedentary lifestyle, you'll be sitting for long time. So example, IT based people, they will have always sitting posture. Then again, we need to keep our posture correct. We need to keep, continuous sitting is also not good. Half an hour से ज़्यादा कभी कोई भी बैठना नहीं. आप बैठेंगे continuously, then you can get back pain. The way you sit, posture आपका सही नहीं है. The way you see, there's so many things. The way you sit, the way you stand, the way you lie down plays vital role in keeping your body in maximum possible alignment. अगर वो alignment सही नहीं है, then there are more chances of you getting some of the other problems. So obesity again, because sedentary lifestyle, it's complicated, and with that obesity comes. With obesity, there's so many other things we get. Example, you were talking osteoarthritis, back pain, neck pain, and so many other things. So everybody should have some or the other physical activity in their life. If they don't have physical activity, then it will cause so many problems.
So how do you prepare yourself in the morning?
Morning, I'll get up and do some puja. Then, see, the thing is, we prepare with whatever patients are coming. Once the patient comes, we think about it, how to deal with this kind of patient in a different way possible, and to get rid of their problem. Either it can be pain or any other things. So, how to get rid fast, what best can be done in lowest possible time. So, the lesser time, the more impact, and the faster. That's what our aim would be, and we day in day out. That's the only thing we do.
तो पेशेंट कोई अनविलिंग पेशेंट होता है, they don't want to follow the instructions, they are very not compliant with all the things you tell them. So how do you deal with this?
Unwilling, see, the thing is, unwilling कब रहते हैं अगर वो लोग दो चार जगह घूमे, कुछ भी काम नहीं हो रहा, और they will feel that हाँ यहाँ पे भी आके भी I don't think something will happen here. वो ऐसा सोच, उन लोगों का सोच वैसा रहता है. अगर वो सोचते, अगर वो लोग आएंगे, so what we have to do is first make them sit and realize what is the problem, how severe is the problem, and how it can be done. Then chalk out a plan. On this plan, if you have to work it out, and we will work it out from our end. From us, if we do 50%, you also have to come 50%. Then only any problem can be solved. Otherwise, it's again you'll be coming, again you'll be taking treatment, you'll go back to your respective life, and again you'll come back. We don't want again and again this repetition of activity to come back again. So for that, the protocol, if you can maintain and do your homework properly, then you don't need to come back again. That's very important.
So how do you keep track of all the patients? उन लोग का progress कैसे उन लोग है?
हाँ, the thing is, once you have done minimum number of treatment sessions, whatever I say, if they do it, then later on we tell them to, do all the activity based. Okay, protocol रहता है, exercise protocol, stretches, सब रहते हैं. आप जैसे जैसे करोगे वैसे पेन कम होगा. Then once in a while they might call us or we will call them and we'll take. And once again, if they are coming with the other problem, then we'll see how previously for what they have come and what they are doing for now, and we'll correlate and again we'll do it in that.
And you're in touch with their relatives, their families also. You talk
Yeah,
to
if
them.
needed, if need an example for neurological patients or pediatric patients, pediatric with neurological problems, family is the main pillar. क्योंकि बच्चों को सही तरीके से ट्रीटमेंट नहीं मिला तो वो डिसेबिलिटी वैसी रहेगा और उसको सही तरीके से हम ट्रीटमेंट नहीं दे सकते, इसीलिए इट्स अ फैमिली सेक्टर. सो वी काउंसिल द फैमिली. मोस्ट ऑफ द फैमिली मेंबर्स वुड बी इन अ डिनायल स्टेट. क्योंकि डिनायल क्यों, मेरा बच्चा ही क्यों, क्यों इनको भी हुआ है, दैट ऑल क्वेश्चंस वो अराइज होते हैं. Then what they do is, we need to make them again counsel करके, then home program हम यहाँ पे कर रहे हैं, आप भी करो. Then slowly improvement आएगा. जैसे जैसे improvement आते जाएगा, it's a neurological problem. We have to set small goals first, then long-term goals. Then only we'll be able to deal with the problem list वो बना के correctly सही तरीके से treatment करेंगे तो मैक्सिमम चीजें अचीव होने के चांसेस 100% हो.
So home program में how do you keep track of what is happening?
Yeah, we tell them to parents how to do and what to do, what not to do. Then we'll see whether they are following or not. If they follow, there will be some or the other improvement will be there. They will show. If not, then we'll come to know. Then we'll tell them you're not doing this. That's why these things are happening. It's a give and take process. हम कुछ बोल रहे हैं, वो लोग भी विजिट कर रहे हैं, या नहीं ये मेरे को करने नहीं आ रहा है तो हम नहीं कर पा रहे, तो हम मॉडिफाई करके उसको ये करिए, so that it's a win-win situation for both of us. In that way it will be
काफी challenges आते हैं.
Absolutely, definitely there are so many challenges. See, in any field we work on the limitations. Either we limitation, we have to work in between the limitations. So challenges कब आते हैं? Patients if they are not properly coming, मतलब एक दिन आके फिर 2 दिन नहीं आना, then they'll ask, pain कम नहीं हो रहा. Okay, sometimes patients come regularly, but the severity of the problem will be more. And the severity of the problem, they need to come more sessions. Then they feel I'm coming so many sessions, still it is not coming down. Like the questions and challenges are there. We need to make them aware. Problem जैसा है उसके हिसाब से we have to work it out. Then only they get improvement. Otherwise, it's very difficult.
The doctor till date कौन सी achievement आपको सबसे बड़ा achievement लगा? Greatest achievement?
Yes, actually, I am specialized in hands-on techniques. उसमें CST बोल के एक treatment है, craniosacral therapy, which I have been practicing from 15 years, more than 15 years. So it's a very light test treatment.
What is that?
It's craniosacral therapy. Craniosacral therapy, it's a very light test treatment. We treat it for stress-related problems. We treat it for neurological problems. We treat it for pain-related problems. Nerve compressions इनको रहते हैं back or neck में. We release the nerves. This with hands-on, very subtle, very light test. There's so many things, treatments which I do. I do chiropractic. Chiropractic बोले तो, you might be seeing all the videos which are coming up where manipulations करते हैं joints को, sounds आता है, very
तो US में ज़्यादा है.
Yes, UK, US, Australia, वहीं से ही शुरू हुआ है chiropractic. So I am also specialized in something called visceral manipulations.
What is that?
Viscera means heart, lung, liver, kidney, intestine. सबको हाथों से ही उसका function पढ़ाना. So there are techniques, there are things which we do maneuvers करते हैं, then उसको function बढ़ाते हैं. Like that. No, these are techniques. There is no massage. We don't do much of massage. The techniques which we follow. अगर example heart है, तो heart को release ये तरीके से करें तो heart release होता है. Example कि बहुत सारे लोगों को ये हाइटस हर्निया होते हैं. हाइटस हर्निया बोले तो गैस्ट्रोइसोफेजियल रिफ्लक्स, जो आपको एसिडिटी जो है उल्टा आता है, खट्टे डकार आता है. उन लोगों को थोड़े टेक्निक्स करेंगे तो सर्जरी अवॉइड करके we can make it sure that gastroesophageal reflex is coming down.
कभी कभी
बहुत
होता है बैक में वो लंबस स्पाइन थोड़ा इधर उधर हो जाता है, गैप्स रह जाता है, तो ये
कायरोप्रैक्टिस एब्सोल्युटली अलाइनमेंट सेट करने में बहुत बहुत वंडरफुल है, क्योंकि द मेन प्रॉब्लम इज posture. We don't keep the posture in a proper way. We normally nowadays every person slouch sitting with mobiles and laptops, lying down and watching TVs, lying down and watching mobiles, and so many things we do, which causes our alignment dysfunction. So once that alignment dysfunction takes place, in the long run, some or the other time, slowly, now compressions will take place, or the displacement will be there. I mean, then your pains, problems will start. That can cause again, disc bulges, disc indentations, disc herniations. वो आपको nerve compression में help करता है. Then some of the other problems, back pains हो सकते हैं, neck pain हो सकता है. So that is what proper posture and alignment. If कोई भी कर रहा है, तो आपको कोई problem normally nahi aayega.
And how food is related to all this?
Obviously, food is the first medicine. Is food. So if we keep our food, limited to how much we have to eat, and if we eat in a proper way, proper diet, if you maintain, definitely it percolates. All vital nutrients and all nutrients which comes. If we are doing in a better way, then everything, body function will be perfect. Once the body function is perfect, you don't need to do anything. So, absolutely, junk food and all should be avoided. Nowadays,
the children don't like it.
every child favorite food is junk food, and lying down and watching mobile, TV, and stuff like that. That is where we are dealing now. 7 years, 8 years, children are coming to the clinic with pain. Previously, we used to see only adult age group with pain, or geriatric. Geriatric बोलते हैं age ज़्यादा होता है. वो age group वालों को हम देखते थे pains और problems. Nowadays, it's become very younger age group are coming with a lot of pains and problems, which was never heard 10-20 years back. When I started my practice, there was no pediatric patients with pain. Now, because of all wrong postures, wrong things, I'm seeing a lot of patients.
Tell us about your books, the 3 books you have written.
Yeah. एक जो है मैं बात कर रहा था वो Truly Control and Physiotherapy, जिनको न्यूरोलॉजिकल डिसेबिलिटी रहता है, वो तब क्या होता है, मुंह बंद है या नहीं है, उन लोगों को उतना ज्ञान नहीं रहता. They will not be able to take, that मालूम नहीं रहता, because either it might be physical or neurological or intellectual disability की वजह से they will try to open their mouth really. Because of that, there can be salivation. वो saliva के लिए there are some techniques if the mother does and help the child to make them aware. Again, same thing. अगर मुंह ओपन है या नहीं, तो ये टोन हाइपोटोनिया है, हाइपरटोनिया है. हाइपरटोनिया बोले तो जिनको न्यूरोलॉजिकल प्रॉब्लम रहता, ये टोन ज्यादा रहता, तो उस वजह से उनको मालूम नहीं पड़ता. तो बहुत सारे टेक्निक्स हैं, और टेक्निक्स को हमें बुक में बहुत लिख चुका, और टेक्निक्स और ट्रीटमेंट्स करते जाएंगे तो अवेयरनेस टू द ब्रेन जाएगा. तो उस वजह से then they'll try to keep their mouth closed. And normally what we if salivation takes place, we tend to swallow it inside. So वो swallow करने के लिए अगर वो बच्चा पोस्चर सही नहीं मेंटेन कर रहा है, अगर वो बच्चा ऐसा रहेगा तो टपक के रहेगा. पोस्चर मेंटेन कैसे करना है, बॉडी अवेयरनेस कैसे करना है, वो सब डिटेल में लिखा है. और एक बुक होम प्रोग्राम फॉर द डिसेबिलिटी, घर में क्या क्या एक्सरसाइज करें तो बच्चों को क्या क्या चीजें होता है, वो एक और एक बुक लिखा है. सो है NIMH पब्लिकेशन में है, सिकंदराबाद, उसमें लिखा है.
और Amazon में, फ्लिपकार्ट में
नहीं, वो वैसा नहीं है. दिस इज नेशनल, कि ये सेंट्रल गवर्नमेंट का है. सो NIMH पब्लिकेशन में ही रहता है. इट्स नॉट अवेलेबल आउटसाइड. वो गवर्नमेंट स्पॉन्सर्ड रहता है. So NIMH National Institute for the Mentally Handicapped सिकंदराबाद में है, तो वहाँ पे मिल जाएगा, उसका publications है. If you can go, you can get that.
Because lot of people do suffer, lot of families do suffer. बच्चे ऐसा है तो they should know awareness.
Absolutely. बहुत सारा awareness की जरूरत है. Still, I think very less awareness. Cities में अच्छा है. Even rural areas, they try to neglect the child because if he is not able to cope up, even in the cities, they don't mingle with the children. There's so many things out there. Challenges are so many. That way, so many people miss out.
So do you think digital media would help with this to spread the awareness?
Definitely.
Talking to groups of people, to organizations.
Absolutely, there are so many, autism awareness day groups, societies are there. With cerebral palsy, Indian Academy of Cerebral Palsy. There are so many things out there. So they are doing their best, and digital media also will help in, making them aware. So if you get this kind of children, how to deal with it? There are so many groups. You can go to there and you submit.
Are there groups in Hyderabad?
Yeah. Indian Academy of Cerebral Palsy is a Hyderabad place. So Dr. A.K. Purohit is a wonderful person who is doing a lot of service since 20 years. So like that, so many groups are there. So you can get, then so many things you can do. So once you get aware, अगर ऐसे ग्रुप्स में आप ज्वाइन होंगे तो पेरेंटल मीटिंग्स होते हैं, then क्या होता है, you will tell your own things, then they will tell their own challenges, they get to learn from that parent to this parent, then only they'll be able to do justification to the child in a better possible.
So how do you spend your leisure times? Do you watch movies? Do you go for plays? What do you do?
Yeah, I mean, leisure time, I watch movies, and sometimes I do sing and some things which will help.
So we'd love to hear you sing. Please, 2 lines.
One very good song which I love is from Mohammed Rafi, Ehsan Tera Hoga.
Oh, please.
एहसान तेरा होगा मुझ पे, चाहता है वो कहने दो मुझे, तुमसे मोहब्बत हो गई है मुझे, पलकों की छाँव में रहने दो, एहसान तेरा होगा मुझ पे.
Wow. Very nice.
So there's so many things like that. We also need to have a recharge, of mind, body, soul.
Of course.
So we do these kind of things.
Yes. So we have come to the end of our chat. So do you have anything to tell our viewers?
Yes.
Some message, something?
Yes, definitely. See, the thing is, don't wait till long time. Any pain, problem or anything, if somebody is having, definitely they should, go for it as early as possible. Don't delay the process. If you delay the process, then some or the other problems may arise and it can cause bigger problems. So, छोटा है जब आप कुछ सही नहीं करोगे, there is a saying, a stitch at time it saves time. So, अगर आप सही तरीके से सही टाइम पे नहीं जाओगे, then it can cause problem. List को बढ़ते जाएगा, then you will not get results to it. So always we be as early as possible.
And also we should be aware of our health.
Yes.
Mental and physical health.
Yes, absolutely. Even psychological problems. There are a lot of now because of sedentary lifestyle and so many, not going anywhere out. People are getting locked up. Digital media, everything is in your phone and everything. You don't need to go out. Everything is here. So psychological problems are becoming more.
Yes.
I'm seeing a lot of psychological problem patients with CST home. So that also makes difference. So be aware of your problemness and get rid of it. Don't start living with it. Get rid of the problem.
Thank you. Thank you so much, sir.
Yes.
Thank you. Thank you.